Lindsey. Thank you for being here
Hi.
today. How are you?
Great, thanks.
Can you take a few moments to introduce yourself? Tell us how long you've been an SLP, what setting do you work in, and any additional roles or credentials you have.
So I'm Lindsey Wise. I've been a medical SLP for right around 13 years at an acute care hospital. And I'm also the department manager for the rehab department.
So needless to say, you bring many years of experience, and your role as the rehab department manager will be applicable to the topics for this conversation. So let's jump right in, okay?
All
So
right.
I knew when I started that I wanted to work with adults, and I had aspirations, no pun intended, to become a medical SLP. However, the reality that I was facing that was without the experience, it was challenging to get hired in the medical setting. So I'd like to discuss some of those barriers with you and how to overcome those. So as the rehab department manager, you're also involved in the hiring. So how can an SLP at any level of their journey enhance their resume to highlight experiences for medical SLP jobs?
Sure. So make sure that in your resume, you've limited it to 1 to 2 pages. Anticipate that they're going to look at your resume for no more than 10 seconds to begin with. Then give them a second page that has CEU courses that you have taken that are applicable to the field. If you're applying for a job with adults, don't focus on your pediatric experiences. And then also make sure that you've gotten to know the people, whether through Facebook groups, whether it's CEUs, anything like that. But get to know the people that might be hiring you. And if it doesn't go the way you want it to, I want you to remember that every no is actually more of a not right now, because our circumstances as hiring managers may change throughout the time periods.
Okay. You mentioned CEU. So along with any CEUs, can you suggest any assessments that may be helpful to familiarize yourself with in the medical setting?
Sure. So some of my favorite CEUs are the Patsy Mirror courses because they're free, focusing on traits and vent. Other cost-effective courses are from Dr. Inessa Umbert, doing the STEP courses. Eric Blicker has some courses that are about $40 for 65 hours. I'm not associated with any of these places or any of these courses. I have just noticed that they are fantastic information on keeping evidence-based in the new situations that we're in. Courses or assessments, I focus on the QAB, the MAST, Eat 10, the Yale 3-ounce water swallow protocol. Some of those courses that are free, or not courses, I'm sorry, assessments that are free, but are very, very vital and useful in our setting.
Okay, those are great starting points. So let's shift topics a little bit, and I want to briefly touch on the notorious bedside swallow evaluation and the modified barium swallow study. So to start with, what are some key components to learn or be prepared for with the BSE?
So chart review is always the most important place to start, because unless you know kind of what you're getting into in the acute care setting, you don't know what to prepare for, what to plan for. And then once you're actually with your patient, can you do the Yale 3-ounce water swallow protocol? That's very, very good at identifying who needs an instrumental and who may not. Knowing how to do your cranial nerve exams, which trials to give, when not to give, that sort of thing.
Okay, and as far as the MBSS, is that the most common instrumental assessment?
Not necessarily. Some hospitals rely exclusively on fees because that's what they have available. Others are pretty exclusive to modifieds because, again, that's what they have available. So you need to know what your desired location has and start taking some of those courses. But don't forget that everybody starts at the bedside more so than they do these instrumental assessments right off the bat.
That's really good information. I think they may relieve some of that pressure there. So when you are applying for that job that you're referring to, how important is it for you to know how to complete an MBSS?
Depends on the job. Remember that circumstances change. If you're a weekend therapist and we don't have a radiologist on site, then it may not be very important for you at all, because the odds of you actually getting to train on those is very, very low because you won't be exposed to them. So if that is something that you professionally want to achieve, that might actually mean that during your summer vacations, during breaks, anything, you have to come up when the radiologist is available to train with them. But again, everybody gets the bedside swallow eval, not necessarily everyone gets the modified barium swallow. And so you need to make sure that you can identify which ones do and which ones don't, but don't focus on that right off the bat.
That's very helpful advice. So in closing, what helpful information or thoughts can you leave students, clinical fellows, and SLPs who want to enter the medical setting?
Sure. So as you're preparing yourself, really focus on generalized medical conditions. So not just the things that you might have learned in school, the sodium, things like that, but general labs. Do you know the implications of COPD on your patients? What are some of those common causes of altered mental status? Ammonia, metabolic, other issues like that. Look into some of those kind of things. The chart review, again, is most important, but don't get so caught up in the chart review that you are spending so much time on that and not actually with your patient. Don't focus so heavily on this superfluous, beautiful documentation language that we might have learned in grad school, because doctors don't actually understand what those things are most of the time. And so I value more clear and concise documentation than anything else. And don't get discouraged by what you don't know. Just keep moving, keep learning.
All right. Thank you again, Lindsey, for your time. And I hope everyone finds all the information and content that you provided very beneficial and can feel a little more confident when they're applying for their job, for those jobs in the medical setting. So I appreciate your time again, Lindsey.
Thank you.
Thanks. Bye-bye.